Sean? Hi, come on in. I'll take you right down this way. Come on in. Take you all the way to the end, okay? How's everything with you today?
It's good. It's
awesome. Okay, I'm gonna take you right to this room over here, okay? Have a seat after you, right in there. I'm gonna open this up for you. Have a seat.
Thank you.
You're welcome. So, how is everything with you?
Doing well.
Yeah.
Not flossing or brushing. Brushing, but not flossing as much as I should.
Okay.
Yeah.
Any concerns? Any sensitive spots?
Sensitivity along the gum line,
Okay.
and probably some areas in the back on the
Okay.
molars.
Now, would you say it's more or less to colds or hot?
Both.
Okay.
Yeah.
Okay, excellent. Well, we'll have a look.
Okay.
How about your medical history? Are there any changes? Any
No.
new medications? Any allergies?
No.
Okay, great. Very good. So we're going to get started. I'm going to put you back. Is that okay?
Sure. Absolutely.
Perfect. So let me just place this bib on, okay? So how's your day so far?
It's doing well.
Yeah.
Working lots.
Oh, a long day?
Yeah.
All right. Okay, so here we go. I'm going to put you back, okay? And when was your last cleaning?
Ooh.
Has it been a while?
I think it's been more than 8 months.
Oh, okay. Now, when we clean your teeth, do you find there's a lot of sensitivity during cleaning?
I'm usually okay.
Okay, great. Very good. So let me just give you these protective glasses, okay? So here you go. I'm going to protect your eyes.
See?
And I'm just going to get my instruments ready, okay? Perfect. Did you have a nice summer?
Yeah, it was a great summer.
Did you do anything?
Traveling a lot.
Oh, good. Where'd you go?
Out to California and London.
Oh, wow. So you've been busy.
Yeah.
Okay. So what I'm going to do is I'm going to shine some light, okay? I'm going to kind of have a look, check all your teeth, and see if there's any cavities.
All right.
Okay, Sean, so first thing I'm going to do is I'm going to check all of your teeth, okay? So we're looking for any suspicious spots, okay? And what I'm seeing, just by looking at your lower molars here, are these potholes. We call them potholes because you have worn through the first layer of the enamel, okay? So that is usually from a little bit of clenching, a little bit of grinding, probably in your sleep. So you would not necessarily know that you're doing that. Sometimes you can actually wake up in the morning and you can end up with really sore jaws, and that's how you would know that you're starting to clench and grind. But what I want to show you today is some of these potholes. So I have this, intraoral camera that's going to allow me to take pictures of those potholes, just so I can show you on the screen. Okay?
All right.
So let's see if we can do that. So stay open for me. There's one. Then we're going to take one on the bottom here, okay? And I'm also going to show you one little suspicious spot on your upper left molar, okay? And there it is. Okay, perfect. Okay, Sean, so you have this wire on your lower front teeth, okay? It is great at keeping your lower teeth nice and straight, but what happens is you get a little bit more of the tartar buildup behind it, okay? So what I would like to do today is actually use a water pick, if that's okay with you.
That's fine, yeah.
It does spray a lot of water. It makes a lot of noise. So you let me know if you need a break or it becomes too sensitive, okay?
Right.
I'll make sure I'll give you lots of breaks, okay?
Okay.
So first goes in suction. Here we go. And I'm going to start on the bottom front teeth first. I'm going to make sure I go nice and slow so you get used to the feeling, okay? But absolutely let me know if you need a break, okay? So here we go. Just a little bit of noise and water. How's that?
Fine.
Yeah? Okay. So don't hesitate to stop me if you find that there's too much water, okay? So this area usually is really hard to floss as well. So you will find that you will get this buildup quite often. So that is quite normal. We have a lot of the saliva pools at the back of our front teeth. And it causes all that tartar buildup. How is that? Are you okay with that?
Oh, it's fine.
Perfect. Let me just try the front here, just to make sure you get used to the water and the vibrations, okay? I'm just gonna use a little bit more water. Here we go. So as you mentioned, Sean, you're not flossing regularly, so what happens is your gum gets quite irritated, and it gets puffy and it starts to bleed quite easily. So that's what I'm noticing here at the front, okay? With regular flossing, and after today's cleaning, your gums should tighten up a little bit more, and you should see far less bleeding from now on, okay? I'm doing really good with the Cavitron here. So I'm really starting out nice and slow, and as we progress, we'll make sure that we get in there a little bit more, okay? How's the water?
Oh, I feel nothing.
Perfect. So I'm going to continue here around that wire. Perfect. And if you can open for me just a little bit more, that would be great. Thank you. Now I've noticed that this wire has broke a little bit. Yeah? Are you okay with that? Perfect. If that ever becomes an issue or you would like to straighten these teeth again, just let us know.
Okay.
Okay? Perfect. So the one nice thing with the Cavitron is the water really allows me to flush the plaque from around your gums. And also removes the tartar buildup as well, okay? How are you doing?
Good.
Perfect. So after today's cleaning, you might even notice that your gums are a little bit sore. That's to be expected. Within a few days, you should be back to normal, okay? Very good. And I'm just going to continue on the lower right here, okay? And if you can open for me just a little bit more, that would be great. So far, so good?
Yep.
Excellent. And open again. That's great. So far, okay with the water pick?
Yeah.
Excellent.
Feel nothing, yeah.
Perfect. All right. Yeah, I always keep coming back to these lower teeth because that's where the tartar builds up the most. So I just keep on returning back and we'll eventually remove all of the tartar, okay? Great. Lots of water. There you go. Still doing okay?
Yeah.
Perfect. All right, so I'm gonna start on your upper right.
Okay.
There we go. Lots of water again, okay? Yeah, your teeth look nice and straight at the front here. Do you still have a retainer?
No.
Okay, perfect. How's the sensitivity at the front here? Not too bad? Perfect. Excellent. And let me just move to the upper left. Perfect. All right. Give you another break there. Are you still with me?
Yeah.
Excellent. And now we're going to go on the inside, okay?
Yeah.
And open. A little bit more. That's great. Open up. Just a little bit more. Perfect. Thank you. That just allows me to get all the way to the back here, okay?
Mm-hmm.
Yep, lots of water. All right. And open again. That's excellent. Perfect. Okay. Excellent. So I'm going to move to hand scalers, okay?
Okay. Is that it?
No, we're not done. Not yet. We still have to remove some of the little bits and pieces of the tar that are left.
Okay.
The Cavitron doesn't quite get into the tight spots, okay? So what I like to do is use my little skinny instrument and get right in between those teeth. Right in there. Perfect. Is that okay with you?
Mm-hmm.
Yeah, your gum is bleeding just a little bit right in this area, okay?
Okay.
So what you're hearing is actually just that mineral that I'm removing or scraping off your teeth, okay?
Mm-hmm.
Yeah, sometimes it sounds worse than it is.
Mm-hmm.
Sorry.
Sorry.
Go ahead.
Got a cold.
Oh no.
Yeah.
Yeah, it's a bad time of the year right now, that's for sure.
Mm-hmm.
Excellent. Yeah, so this will be usually your biggest challenge, is trying to get in there with the floss and,
Yeah.
you know, maintaining the gum.
Yeah.
And open. Okay. So what do you have planned after today?
More work.
More work?
Yeah.
Oh my gosh.
It's okay.
Are you okay with the pressure that I'm putting on?
Mm-hmm.
Perfect.
And flossing.
Oh, that's it. Baby steps. Perfect, good. Just gonna switch my instrument here. So are you planning anything for the new year?
No,
No.
not really, yeah.
All right. I don't know, they're calling for a pretty bad winter, so
Mm-hmm.
we'd have to get get ready for that.
Mm-hmm. Love the snow, so that's gonna be great.
Oh, do you?
Oh, yeah.
Oh, awesome. Do you do a lot of snowboarding?
Skiing and yeah.
Oh, okay. Wasn't a good year last year for that.
Not at all.
Now press down on your tongue if that's okay. Perfect. So really, everywhere else it seems to be pretty good. You are doing a good job brushing. We just need to get you back on track with the flossing
Mm-hmm.
and get those gums nice and healthy and nice and tight.
Mm-hmm. Right.
But you have nice strong teeth here at the front, that's for sure.
Mm.
All right, let me just use some suction, okay? There we go. How are you doing?
Fine.
Perfect. Alrighty, and we're just gonna scale on the inside, okay? Just to remove some of that plaque around these molars and premolars. Yeah, there's even a little bit of wear on your canines here, but nothing major.
Wow.
And I see some deeper grooves as well, but they're just stained.
Mm-hmm.
And stain doesn't cause disease, so we should be okay with that. We're just gonna polish them up, make sure they're nice and clean, okay?
Okay. Is that from coffee?
Yeah,
Yeah.
can be from coffee,
Okay.
our diets as well. You know,
Okay.
we have a lot of blueberries, strawberries, everything that we eat in our diet has natural stains.
Mm-hmm.
So then you end up having just the stains in the tight spots here, okay?
Okay.
So I'm just checking in between your teeth, just to make sure that we haven't missed anything. And open just a little bit more for me, that's great. Just to make sure that all feels nice and smooth in between. Okay, that feels good here. And you must be right-handed.
Mm-hmm.
I find a little bit more plaque on this little corner
Oh.
because we tend to brush mostly on the
Okay.
right-hand side,
Yeah.
skip over the corner, and then brush on the right side.
Oh, that's
So
what's happening.
yeah, so pay attention to this corner right here just to make sure that's nice and clean, okay? Okay, that feels good. And we're gonna check on the other side, okay? Perfect. just in between, under your gums. Check all the little grooves. Perfect. And up on top here. It's nice and quiet in here today. Must be lunchtime. Okay, and let's check on your upper left. Good. And just on the inside here, okay?
Okay.
Clean my mirror. And one of the potholes that I was talking about earlier has actually turned a little sticky, okay? So I'm gonna have Dr. Dave just come in and just double check that area, because when it becomes sticky, usually, you know, you might be starting a cavity. So we wanna make sure we fill that before it turns into a cavity, okay?
Okay.
And I'm just gonna finish up checking the rest of your teeth here. And similarly on the other side here, okay? Just gonna have Dr. Dave check that as well. Perfect. Okay. So let me check your soft tissues, okay? We wanna make sure that your gums and your cheeks and your tongue are all healthy. We're looking for any bumps or lumps that shouldn't be there. That's okay, that's okay. And open. And put your tongue right up here and over here. Okay, and the other side. That's perfect. And I'm also gonna check at the back of your throat, okay? Say ah. Perfect. That looks good. Now I do need to dry the lower teeth just to make sure I haven't missed any tartar.
Okay.
So I'm gonna spray some air. You might feel a little bit of cold, okay? So here we go. Just gonna dry those lower teeth a little bit. Tartar usually comes out almost like a chalk when you dry the teeth. So then we know that we need to go back and recheck those areas. And on the inside, cold?
No, it's good.
Excellent.
It's from my tongue where you tried to dry.
Oh,
Yeah.
that's okay. And open. And I'm just gonna double check on the inside. Okay, so I see a couple spots. So if you can just stay nice and open for me for 1 second. Don't close, okay? Perfect. There's just a couple of spots here that I noticed. And it's usually right around that bonding and the wire. That's where it builds up the most. Perfect. All right. So let me floss your teeth, okay? And I find the easiest way to floss is if you wrap the floss around your middle fingers.
Okay.
And you have your thumb and your index finger to hold the floss, okay? You have a little bit more control. And then you can go in and you can hug the teeth on each side. That way you know you clean out that little triangle that you have in between the teeth, okay? You want to hug the teeth on each side. Now it might be a little tricky around this wire, so try to get in there as much as you can. You doing okay? Perfect. Your teeth are quite tight too. Right in there. Perfect. And I'm going to floss on the top, okay? So if you see a little bit of bleeding the first time around your flossing, that's okay. Your gums are just starting to get used to the floss. So continue, and eventually you should see less and less bleeding. And the last molar. Perfect. Okay. So the last thing we're going to do is we're going to polish your teeth, okay? Would you prefer mint?
Mint's fine.
Yeah? Okay, sounds good. So the polishing removes the fine layer of the bacteria, okay? Also removes some of the staining we were talking about.
Yeah.
So let's do that. And I'm going to stretch your cheek just a little bit here, okay? Are you okay with that?
Yeah.
Perfect. My little polisher is a little noisy today. Perfect. Doing okay?
Yeah.
Okay. And open it. Perfect. Lots of stretching at the back. This might tickle on your palate a little bit. Okay, let's polish the lower teeth. Lots of stretching again. Okay here? Perfect. Okay, and the other side. Okay, and finally on the inside, and you'll be all done, okay? Okay. Excellent. Very good. I will let you rinse, and then we'll have Dr. Dave come in.
That's it?
Yeah.
Wow.
And I will sit you up, and there's a cup there by the sink. There you go. Okay, so I'm gonna have you rinse, and I'm gonna save those pictures that I've taken, and I'll be able to show you what I was seeing in the
Okay.
mouth, okay?
Actually, my teeth don't look that bad.
No,
Like whitening wise,
no, I
they're
agree.
not bad at all.
Okay, so I'm just gonna move that out of the way. Okay, and if you have a look at the monitor, this is the upper left molar that I was talking about. See this little pothole?
Yeah.
There's a little bubble in there, but you'll be able to see as soon as you dry it that it has gone into that second layer and it's sticking quite a bit.
Okay.
So that is something you might want to seal for sure.
Okay.
Same thing. Let me just show you this one. Same thing. Natural groove. It has possibly started a cavity. So I'm
Okay.
going to have Dr. Dave come in and just double check that for you. Okay.
Okay.
And these are all the little spots that I'm noticing. Again, there might be a similar groove,
Okay.
a little sticky spot.
Okay.
Sorry. Again, little sticky spot here. And these are all natural grooves. So what we do when you turn 6 and 12, we seal them.
Yeah.
But the sealants tend to come out.
Oh,
So what do
okay.
we have to do when they come out? We have to reseal them,
Seal them.
right?
Okay. So we're up to.
And now we're going to see the little potholes. Now it's hard to see, but it was actually easier to see in the mirror. But again, you'll be able to see that pothole in there. And we have one more tooth on the other side, pothole in there.
Okay.
Okay?
Wow. Okay.
Excellent.
Thank you.
So I'm going to have you sit down, and
Okay.
I'm going to have Dr. Dave come in, and he will check everything out for you.
Okay.
Okay?
Thank
Have
you.
a seat. Okay, Dr. Dave, this is Sean.
Hello, Sean. Hi, Dave. How are you?
Good. How are you?
I'm good, good. Thank you very much. And had a nice cleaning then?
Yeah. Teeth feel
That's
great.
Feels good, eh?
Yeah, yeah.
About the kid, that's thing to talk about.
Yeah.
She's best. Okay.
you.
Before you are today over here for your regular checkup and also
Okay.
the cleaning. Cleaning has
Okay.
been done. Before I check your X-rays in your teeth, is there anything that bothers you? Any concerns about your teeth?
No, I mean, well, there's some pockets and stuff, and I think I've been grinding. A little bit of sensitivity near the gums.
Oh, okay.
Yeah.
But they are not sharp or anything, right? The teeth.
No, sharp teeth.
Okay, so what I'm going to do, I'm going to have a quick look at your x-rays and your teeth, and if there is anything that I see that needs to be worked on, I'm going to let you know. Okay?
Great.
All right.
Okay, so Dr. Dave, we updated Bitewings last time. Sean is actually doing a great job brushing, but we're working on the flossing. I showed Sean the proper technique.
Okay.
I also noticed a couple of spots, little potholes on his lower molars from grinding.
Okay.
And I did show Sean in the mirror, and I also took some intraoral pictures to show you, okay?
Okay. All right, let's have a look at it.
So I'm gonna bring
So,
those
Sean,
up.
if you don't mind, I'm just going to check your x-rays over here first, okay?
Okay.
So this is the upper left molar, the 2-6 occlusal.
Okay.
It is actually sticking a little bit, so I was just a little suspicious.
All right.
And we have a couple of the other deeper grooves that are starting to break down, and also the little potholes I was talking about
Right.
there, and also there, okay?
Okay.
But they're all written down. If you can check those for me, please.
All right,
And
sure.
I'll bring those bite wings back again. There you go. Got nice strong teeth though.
Yeah. Good bone level, everything is good. Okay, so can I have a mask, please?
Yes,
just for a
please.
second? Thank you. You got a good look at your teeth, eh?
Yeah.
All right. All right, so I'm going to have a quick look. I'm going to lean you back a little bit.
A little tall for this chair.
And I did check the intraoral tissues. Cheeks, tongue, back of the throat was all within normal.
Mm-hmm.
And I've noticed the wire on the lower front teeth has broke. Sean is not really concerned with that.
Oh, okay. Sure, I'm just going to run my finger over here. If you feel any discomfort or pain, let me know, okay? Okay. Okay, could you please tell me all those numbers?
Sure, 1-7 occlusal.
Yes, okay, there is a catch there. Of course, we need to fix it.
And 1-6 lingual deep groove.
Yes, I agree.
2-6 occlusal.
Just a second. You all right, Sean?
Mm-hmm.
Yeah, the pothole, yes.
And 2-7 OL.
Perfect. Yeah, I agree.
And then we have the potholes on the 3-6 and 4-6 as well from grinding.
I agree with the 4-6 as well. There's one spot I just need to double check it. Was there anything put under observation last time for 3-6, if at all?
I can double check. But I can make a note of that as well.
Sure. We're gonna put an observation for now,
Okay.
okay? All right, so could you please stick your tongue out over here on this side first? Thank you very much. Now on the other side. Okay, and could you please put the tongue on the floor of the mouth? Right, relax and say ah. All right.
Okay.
All right, first of all, the tissues looks pretty good, okay?
Okay.
Now about the teeth, the spots like Kate already diagnosed, they've been actually concerned, and we want to actually make sure that they've been sealed.
Okay.
And few of them you can already see over here, like it's the first layer of the tooth is already chipped, and some stains and cavity is starting over here. We don't want it to become something bigger, okay?
Okay.
So we want to seal that.
Yeah.
And it's on all over your mouth, okay? It's basically all your back molars that have them.
Okay.
The bottom 2 molars have just the potholes is because of the grinding,
Okay.
and you're actually losing the bone, so the tooth around here, okay?
Okay.
So what it does, it becomes like a food pocket for you.
Yeah.
Eventually it creates a pocket for the food, and then bacteria, everything comes there, and it starts becoming a cavity, okay? So we don't want that. In terms of the one tooth, as I was checking in the x-rays, is your bottom left tooth. Now if you can just see over here, there is a small darkness around here, eh?
Yeah.
And you can see how normal it is, almost normal on this side, eh? But this tooth, this darkness is usually the starting of the cavity.
Okay.
Now when we usually treat is this darkness, if it actually goes inside the second layer, that's
Okay.
called dentin.
Okay.
Right now it seems like it's just in the first one, so we're just gonna keep an eye on that.
Okay.
On your part, what you need to do is just keep on flossing that area, so not more food is, nothing is actually sticking there to create it more bigger, okay?
Okay.
And also use fluoride toothpaste because it also stops the cavity.
Okay.
Apart from that, I don't have any other concerns.
Okay.
Any questions?
Okay. Can I seal those today? Yeah.
Yeah, of course. If you
Yeah.
have time right now, of course, we're just gonna prepare the room and we can get it done today.
Great.
All right.
Great.
Awesome.
All right. Any questions?
No, thank you.
All right. It was nice meeting you today. Okay.
Okay.
Take
Yeah.
care.
Okay,
Thank you.
thank you, Dr. Dave. Okay, well, that's great. So that is it for today. We're going to get those couple of spots sealed today so you don't have to come back. That's awesome.
Okay.
All right.
Fantastic.
So let me just take this off, and Sean, I will be right back. I'm going to see which room they want you in.
All right.
Okay? I'll
Thank
be
you.
back.
All right.
Okay, Sean, great news. Dr. Dave will be able to see you. So I will take those glasses.
All right.
Okay, thank you. And I have a toothbrush and a floss here for you. Remember, only floss those teeth you want to keep. Follow me. I'll take you right down.
All right,
Okay?
thank you.
You're welcome. Come on.